In South Sudan, the Adventist Church suffers violent persecution with injured believers, a burned temple, and the death of an evangelist. Adventist Medical Mission breaks cultural barriers and serves thousands of war refugees from Syria and Lebanon. Robotic medicine connects doctors and patients 11,000 kilometers apart, and science fiction becomes reality in surgery between the United States and Africa. In Panama, a church without a traditional temple grows and baptizes people with no ties to religion. Stories that show how the Adventist mission advances even in extreme scenarios. Now, here on ANN. Welcome. We begin this episode with news from the Middle East. A group of Adventist doctors from Brazil embarked on a humanitarian mission that crossed borders. For several days of intensive care in Lebanon, they provided free assistance to about 2,000 refugees. Through their service, the volunteers provided comfort, hope, and solidarity to people who carry a past marked by war and pain.
Lebanon is a Middle Eastern country that hosts the highest number of refugees per capita in the world. The volunteers worked in partnership with the Winners Project, a charitable organization that supports children and adolescents in the country. The Winners Project has been working since 2021 to minimize the impacts of this crisis on the lives of Lebanese and Syrians through education and sports. We embrace the community where we operate. Just this year, new partnerships were established with the Majda Wanjar City Hall, and over 2,000 health services were provided, thanks to the volunteer groups that have been with us. Coming from various parts of Brazil, these groups carried out a range of long-lasting activities, from renovations to medical services. Through their work and dedication, we were able to alleviate the suffering of many. In 16 days of intense work, about 2,000 Syrian and Lebanese refugees were assisted by the Brazilian team in Maidal Anjar and in camps maintained by the UN. In addition to free consultations, the population also received medications made possible through donations. In total, 22 health professionals made up the team of specialists in the areas of gynecology, mastology, vascular neurology, pediatrics, and general practice. Other professionals such as psychologists, physiotherapists, dentists, and physical educators also joined the group. This time, the team of Brazilian volunteers included a strengthened group of female health professionals, specifically focused on caring for the gynecological health of refugee women. This selection was crucial due to the local culture, which restricts gynecological care by male professionals. In Lebanon, many refugees do not have easy access to medical care because they need to pay for consultations and exams, which is unfeasible for the majority. For the volunteers, bringing help, care, and comfort to them was a rewarding experience. In the refugee camps, children and women responded with love and gratitude for the care received. Even without speaking of religion, the doctors highlighted that they were able to be Jesus without speaking of him, through service, smiles, welcoming, and hugs.
In East Africa, the Seventh-day Adventist Church is growing rapidly, and with that, persecution is also increasing. In South Sudan, a recent attack left people injured and destroyed an Adventist church, but neither threats nor deaths have stopped the progress. The fastest growing church in the region is also the target of the greatest opposition.
In Turali Payam, 17 Seventh-day Adventists were attacked by a crowd. The church was set on fire. 7 were hospitalized. A week earlier, an evangelist was shot dead in the same region. Since 2022, tensions have been rising with the abandonment of traditional religious practices and the advancement of the Adventist message. The area is located within the 1040 window, a region between North Africa and Asia, where Christianity faces the greatest historical opposition, and where most have never heard of Jesus. Even under hostility, Greater Bahar el Ghazal is now the fastest-growing mission field in the country. In June, over 700 new members were baptized. The main tension revolves around the biblical doctrine of the state of the dead, which teaches resurrection and salvation in Jesus. This truth contrasts with local beliefs based on ancestor worship. Despite persecution, leaders assert that faith does not retreat, it strengthens. In South Sudan, the freedom to believe remains alive, taught by Jesus and embraced by thousands.
An Australian book on food and diabetes was named the best health book in the world at the Maine International Award for Gastronomic Literature.
The book Food as Medicine, Cooking to Prevent and Treat Diabetes, loosely translated as Food as Medicine, Recipes to Prevent and Treat Diabetes, is authored by Adventist nutritionist Dr. Sue Radd. The work won the Gourmand World Cookbook Awards, considered the Oscar of cookbooks, surpassing finalists from France, Portugal, Mexico, and Spain. This is the second time that one of the author's works has received this title. The award ceremony took place in Cascais, Portugal, during the World Gastronomy Meeting, with representatives from over 100 countries.
The book is published by the Adventist publisher Signs Publishing and is available in specialized bookstores, Adventist bookstores in Europe, and also online. In Panama, a missionary initiative is changing the way the gospel is presented in large cities. The Seventh-day Adventist Church has developed a new model within the Mission Refocus program to reach secular audiences, and in just 2 years, the results are surprising.
Panama City has nearly 2 million inhabitants and a growing number of people with no ties to any religion. In this context, Conexión 7 emerged, an urban church aimed at professionals and residents of large cities who do not attend religious institutions. More than 130 people gather every Saturday in a rented space within a hotel to study the Bible and participate in social actions. The project started with a small group trained in discipleship. Instead of waiting, they reached out to friends, co-workers, and family with the goal of serving, teaching, and building a purpose-driven community of faith. In 2 years, 52 people were baptized. Real stories show the impact of the model in large cities, with emotional support, prayer in times of crisis, and practical solidarity that made a difference in the lives of many. Conexión 7 grew and gave rise to a new congregation, Conexión Norte, in another region of the capital. The work continues with the same principles of welcoming, discipling, and serving. Based on this growth, the Panama Union, in partnership with the World Headquarters and the Seventh-day Adventist Church in the Inter-American region, began training 11 pastors to expand the model in the country. The goal is to have at least one urban church outside of traditional temples in each of the 6 administrative regions by 2026. In Panama City, more than 500,000 people consider themselves secular. Most believe in God, but do not participate in any church. It is in this context that the missional model finds space with less formality and more practical life. What started as a pilot project is now an approved format ready to be expanded. The Seventh-day Adventist Church in Panama shows that it is possible to grow, serve, and reach out, even where faith seems distant.
In Brazil, thousands of young people gave up their vacation to occupy streets, schools, and communities in the interior of Brazil. The coordinated action of the Adventist Church mobilized the state of Mato Grosso with free services, activities for children, donations, and mass assistance.
During the month of July, one of the largest volunteer movements took action in the west of the state of Mato Grosso. The Caleb Mission Project placed over 11,000 volunteers in the field. They went to neighborhoods on the outskirts of cities, bringing hope, medical assistance, and food. Residents also participated in health fairs with free exams, guidance on healthy habits, and access to various services from massages to blood sugar tests. More than 10 courses were offered, from crochet to personal marketing. Meanwhile, in another neighborhood, the focus was on children. A vacation Bible school with traditional games, workshops, and Bible stories created a space for leisure and learning for dozens of families. In 2 other neighborhoods, the I Want to Be Happy project transformed city squares and gyms into community service hubs. Makeup artists, nurses, hairdressers, and nutritionists came together to assist residents in vulnerable situations. The city also hosted the Caleb Run, which drew 250 runners, included solidarity registrations, and distributed food baskets. In 2 other locations, volunteers organized tournaments, solidarity clotheslines, and donations of food and clothing. The project also included visits to hospitals, nursing homes, blood donations, and renovations of public spaces. For the volunteers, the impact is also personal and spiritual growth. According to them, exchanging vacations for service and finding purpose in the act of helping fills the soul. The Caleb Mission 2025 concludes in July as one of the largest social and spiritual movements in the west of Brazil. This youthful force is transforming cities with practical actions, gestures of solidarity and hope.
In 12 cities in Romania, thousands of people ran for a reason that goes beyond physical health. The 4th edition of the charity run, I Run for My Mom, mobilized thousands of participants and raised funds to help victims of domestic violence.
The charity run I Run for My Mom took place simultaneously in 12 cities in Romania. The event was organized by the student federation Amicus Romania in partnership with ADRA, the Adventist Development and Relief Agency, and featured a total of 2,958 runners. The challenge goes beyond the run. The goal was to raise funds and bring visibility to the Casa ADRA project, which shelters mothers and children who are victims of domestic violence. This year, over 122,000 lei were raised, equivalent to about 27,000 American dollars. Also participating were 350 volunteers in simultaneous awareness actions. In Romania, the Casa ADRA project has been active for 16 years and has already sheltered more than 1,100 victims and assisted thousands, offering psychological support, shelter, food, and legal guidance. The slogan, I Run for My Mom, summarizes the mission of this movement that fights to ensure that no woman or child suffers in silence.
To support the Casa ADRA project, donations can be made at the website adra.ro/doneza. Or to learn more about ADRA's projects around the world, visit adra.org. A historic telesurgery connects the United States and Africa in an unprecedented medical advance. Directly from an Adventist hospital in Florida, Dr. Vip Patel performed a robotic prostate surgery on a patient who was in Angola. The procedure spanned nearly 11,000 kilometers, becoming the longest distance telesurgery ever recorded. A historic achievement that opens new possibilities for delivering healthcare to those who need it most, anywhere in the world.
Imagine now you can help people all over the world at the click of a button. We'll be performing a robotic prostatectomy for a man in Angola who otherwise would not have access to high-end surgical care. We have our team on the ground in Africa, so my team is with the patient and my team is capable of doing the operation and taking over in case something happens, so we've put the safety features in. The connection is 17,000 kilometers in distance of pure fiber. Telesurgery is becoming more and more common, but it's never been done in this way at this distance. Never from the United States to Africa, and never where it's been approved by a legal agency like the FDA. What we've done today allows us to operate in times of pandemic, maybe in times of war. It also allows us to operate in underserved areas, places where they were just never going to get this kind of care. Done. It should change the whole landscape of healthcare where everything gets better because we can we can help people that in the past were just kind of stuck, surgeons and patients. And I think that's what's important.
Nursing students from Southern Adventist University in the United States participated in projects that brought theory and practice closer together, strengthening community health beyond the hospital.
In a local school in Chattanooga, Tennessee, 14 nursing students from Southern Adventist University taught about health to nearly 80 children. They talked about hygiene and gratitude. In Manchester, Kentucky, they helped create safer home environments through the Healthy Homes Initiative, as well as offering free health screenings at a clinic set up in a supermarket. These actions align with the goals of Healthy People 2030, a national initiative aimed at reducing inequalities and expanding access to health care. For the students, the experience showed that caring for people goes beyond the hospital.
Since the beginning of Adventism, women have played a fundamental role in caring for people and preaching the gospel. In Nepal, the legacy remains strong as Adventist women celebrate 30 years of spiritual growth and service to local communities.
The main celebrations took place in the eastern and central regions of Nepal. In eastern Nepal, a women's leadership certification program was held. At the event, more than 110 women participated in a worship service to reflect on the journey of the ministry. Among them, 58 leaders, including pastors' wives, completed the training. The gathering concluded with a fellowship lunch and a moment of sharing testimonies from several of them. In central Nepal, over 145 women from the Kathmandu Valley participated in a joint celebration for the 30th anniversary of the ministry and for Women's Emphasis Day. The leadership of the women's ministry in Nepal highlighted that these 30 years reflect God's faithfulness and the dedication of countless women who have served their families, churches, and communities. The celebration was not only about the past, but also reinforced the vision of a future built by committed and faith-filled women. In celebrating this anniversary, the Adventist Church reaffirmed its commitment to support, empower, and encourage women throughout Nepal to continue leading and serving.
How can we use social media to talk about Jesus? The initiative 10,000 Digital Disciples, sponsored by the Seventh-day Adventist Church in North America, provides an answer. The project is encouraging members to positively engage in the digital world, bringing people closer to Christ. Materials and training in digital evangelism, such as the website Faith Made Social, are helping individuals use online platforms to share faith.
Why do 80% of faith journeys start online? It's about connection, it's about timing, and it's about showing up where people already are. One prayer request, one piece of digital hope, and a heart that was quietly desperate for meaning. Faith Made.
Faith Made Social has been a great asset for me when it came to being a communications director at my home church.
Social isn't just another content tool. It's a bridge between where people are and the Jesus they didn't know they needed.
When I was a communications director here at my church, it taught me how to up my algorithm. It taught me how to up my views. It taught me how to share the gospel in different fun and exciting ways.
Because in a world overloaded with noise, clarity, empathy, and timing still win. Insert name, received a message that simply said, "We're praying for you. Is there anything specific you need?" They had never stepped foot in a church. But in that moment, something shifted. That's not strategy. That's spirit working through intentional digital presence.
She came alongside me back in July 2024 when I was wanting to put on an idol worship. At that time, my belief was rather low. So not only did Chelsea come alongside me and give me practical tools to be able to implement so that we could be able to reach a bigger audience and get more people to come to the event.
These aren't isolated stories. They're part of a growing movement where faith becomes visible, scrollable, and surprisingly personal. Every testimony you just heard started the same way. One post, one click, one step closer.
The social media platform had been open for a few years and nobody had been able to utilize or do anything about it, maybe 1 or 2 views here. But as soon as I got my hands on Faith Made Social, everything changed.
That's the power of a church that chooses to be present online with purpose.
I was able to take the tips and the tools and the strategies that she gave me back in July, and I implemented them way before we were able to start marketing for this Sabbath of Praise event. And I'd say it actually doubled and increased our overall attendance.
Faith Made Social equips churches to do exactly that, not just post content, but create connection, real faith, real impact, right where people are. If you're ready to stop guessing and start reaching, visit faithmadesocial.com, because the gospel doesn't need a stage to be heard. It just needs to show up on time.
Media, multiplication, and mentoring are the three strategic pillars defined by the Seventh-day Adventist Church in the North America region for this digital mission. The next story comes from Nepal, a country located in Central Asia. Thanks to the training and agricultural support provided by the Adventist Humanitarian Agency, ADRA, with the support of the Australian government, people like Lila were able to change the reality of their families. Lila began to grow various vegetables for personal consumption and for sale, thus ensuring the livelihood of her home and a more dignified life.
We were in a very difficult financial situation. I relied entirely on my husband's income. My name is Leela. I am from Nepal. I live here with my 10-year-old son. My eldest son is studying in grade 12 in Kathmandu. My husband went to India for work. I could only afford to buy stationery for the children and save money when my husband sent money home. I grew wheat and maize, which provided only a limited income. At that time, I had to buy vegetables for our daily needs. After being enrolled in the ADRA project, I was eager to learn about the various activities the project offered. As part of the training, we received vegetable seeds, drip irrigation systems, plastic tunnels, and nursery materials. I can now grow enough vegetables for both household use and to sell.
Among the vegetables that my mother grows, my favorites are beans and cabbage.
Every Wednesday, we harvest some vegetables to send to the Agriculture Collection Center. Once the vegetables are ready, the collection vehicle takes them from the farmer's home and transports them to the collection center. Here, the final price is determined through a collaborative process involving the farmers. My income has increased around 10 times compared to what I used to earn from maize and wheat farming. Vegetable farming needs more effort and attention compared to wheat and maize cultivation, but the income it generates is truly impressive, and everything is under my ownership. After being enrolled in the ADRA project and starting vegetable farming, I have been able to generate my own income and become self-reliant. Now, I can afford to buy enough essentials for my family and even save money from my own earnings. I no longer have to rely on my husband's salary for daily expenses or savings. I am able to send both my children to good schools for better education.
My favorite subjects at school are English and Nepali. I enjoy playing with my friends during break time.
I plan to continue with vegetable farming. Currently, we face challenges with regular irrigation, but once this issue is resolved, I aim to increase production in the future. If I hadn't been part of the project, my financial situation would have remained difficult. The situation has improved significantly now.
Meet the musician who has been moving the heart of a global church for years through the power of music.
As business sessions begin, he is already there, offering a prelude that serves as a bridge to the moment of worship. Ken Logan. He is neither a pastor nor a delegate, but few have as much impact as he does in guiding the spiritual atmosphere of a packed auditorium with the right soundtrack. He follows everything in business meetings and votes. He reads faces. He senses the mood, the tension, and he responds with notes that resonate deeper than any speech.
I played first in a rather minimal way in terms of quantity of time in 2005, so this is my 5th session. It's a privilege to be part of a larger picture of helping to shape the spiritual aspect of what people experience, the delegates experience in the voting process and being in business sessions.
Organist for nearly 3 decades at the Pioneer Memorial Church at Andrews University, Logan is responsible for creating the sound atmosphere of the church's largest event, GC Session. He shares that he prepares with dedication, from selecting the repertoire to wearing special shoes.
I'm going to organ shoes, which are very suitable, very good, because they have very thin soles. They're very narrow around here, good height of heel, not too much, well, they basically don't lap over significantly to speak of. And so these are particularly shoes for the organ.
On a stage where the future of the global church is represented, Logan shares he is proud to serve the Lord through music, unifying the world church in worship.
These were this week's stories from around the world. Even amidst war, persecution, and pain, hope continues to move forward. And before we conclude, we leave you with a promise. If you offer help to the hungry and aid to the oppressed, your light will shine in the darkness, and the darkness around you will be as bright as noon. Isaiah 58:10. That's all for today here at ANN. Learn more about the Adventist Church at adventist.org and find other news stories at adventist.news. Until next time.